Um, I'm just going to invite Bishop Bonani of Zimbabwe to speak to us for a few minutes about what's happening because of the COVID-19 pandemic that's in Zimbabwe. So Bishop, please go ahead.
Hello, I'm Bishop Bonani Hadebe, ACOP Zimbabwe. We also now are experiencing the advent of COVID-19 in Zimbabwe, and for quite some time we had been spared that, but now positive cases have begun to surface in the country, and we expect more and more people as testing goes on in different cities. We're expecting even the numbers to increase. Now, the country is on lockdown for 3 weeks, and churches are not meeting during that time. This has been going on for the last 2 weeks as well. We haven't been meeting in the local churches. Initially, we started meeting in small groups, but now those, because of the lockdown now, we can't even meet in small groups. So it's just families and having church in their own homes. And this is something different. This is something new. Unlike in places where there is online services, live streaming, we don't have much of that here because much of our services are not streamed live. And so what happens is pastors kind of are not really in touch now with their congregations other than through telephone or WhatsApp. Excuse me, my chair. Other than through telephone and WhatsApp, we don't have live streaming except for just 1 or 2 big churches. So that is affecting our pastoral work quite a lot because we can't even visit the people at home. We can't visit them in hospitals if they fall sick. We haven't had an experience yet of any of our congregants falling sick and having to be taken to hospital yet. So we don't know what it's going to be like when that happens. But so far, it's still in the early stages. We are on lockdown to try and prevent it from spreading to different people. But pray for us because our health systems are not all that geared for this kind of health emergency. And should we get the full blow of COVID-19, it's going to be quite disastrous because our health services are not really geared for that. They're not up to standard, they're not up to scratch to handle the multitudes that might find themselves in need of health care. So we are trying by all means to also educate the church on preventive measures, how to prevent and to look after themselves, washing of hands, and use of sanitizers if they can find them, and to try and not to be in crowds and protect themselves even from either catching it or spreading it. But we need your prayers because we haven't really felt the full force of it. But if it does hit us, it's going to be quite a disaster.
Thank you very much, Pastor Bonani, for that report, and I'll be able to share that.